How is HPV diagnosed and managed in sex health? Have you ever wondered how human papillomavirus, or HPV, is diagnosed and managed in the realm of sexual health? Understanding this can help you stay informed and proactive about your health. HPV is primarily diagnosed through routine sexual health exams, particularly to identify high-risk types linked to cervical cancer. The main methods for diagnosis include the Pap smear, HPV DNA test, visual examination, and colposcopy. During a Pap smear, a healthcare provider collects cells from the cervix using a swab during a pelvic exam. These cells are examined under a microscope for any abnormal changes that might indicate an HPV infection or precancerous conditions. It's important to note that while the Pap test identifies cellular changes, it does not directly detect HPV. The HPV DNA test, on the other hand, looks for the presence of high-risk HPV DNA in cervical cells. This test can be done alone or alongside a Pap smear, especially for women aged 30 and older. It helps identify infections that could lead to cervical cancer. Samples can be collected by a healthcare provider or even by the patient using a self-collection kit, which is convenient and does not requiring a pelvic exam. For visible genital warts, which are caused by low-risk HPV types, a healthcare provider may diagnose them through a visual examination. These warts typically appear as bumps or cauliflower-like growths on the skin. If further examination is needed, a colposcopy may be performed. This involves using a magnifying instrument after applying acetic acid to the area, which helps highlight infected lesions. If suspicious areas are found, a biopsy may be taken to confirm HPV-related changes or cancer. When it comes to managing HPV, many infections clear up on their own within 1 to 2 years. However, for high-risk HPV types or abnormal Pap results, regular monitoring is essential. This may include repeat Pap smears, HPV tests, or colposcopy to catch any progression to precancer or cancer early. If genital warts are present, treatment options include topical medications, cryotherapy, or surgical removal. While these treatments can remove warts, they do not eliminate the underlying HPV infection. For precancerous cervical changes detected through Pap tests or biopsies, treatments like excisional procedures may be necessary to remove abnormal tissue and prevent cancer progression. Prevention is also a key aspect of HPV management. Vaccination against HPV is highly recommended as a preventive measure. It protects against the most common high-risk and wart-causing HPV types. Ideally, vaccination should occur before sexual debut, but it can also benefit some adults. Lastly, counseling and education about HPV are crucial. Patients should be aware of how HPV is transmitted, its natural history, and the importance of regular screening. Practicing safe sex, including condom use, can reduce the risk of HPV transmission, although it does not eliminate it completely. In summary, HPV diagnosis involves a combination of screening tests and examinations, while management focuses on monitoring, treating visible symptoms, and preventing infection through vaccination and education. Regular follow-up with healthcare professionals is vital for effective sexual health management regarding HPV. Always consult with a healthcare provider for personalized advice and guidance.